India is in the middle of a corona pandemic, and the country's handling of the pandemic has been nothing less than remarkable. But still, a lot more needs to be done. So should the health sector expect big support from the upcoming budget 2022? And will there be SOPs for the healthcare workers? Also, what about the overall infrastructure requirements of India? And will it be given any extra support during the upcoming budget? To discuss all that, we are joined by Shailaja Chandra, former Secretary to the Government of India and former Chief Secretary of Delhi, Mr. Pradeep Multani, President PhD Chambers of Commerce and Industry and Chairman Emeritus of Multani Pharmaceuticals Limited, and Mr. Sandeep Gulati, Managing Director of Aegis India. Welcome, all of you. Ms. Chandra, I'm going to begin with you because you, being a policy maker, have in the past been able to look at this sector very closely, both administratively as well as specifically. How do you see India's performance so far? From 2019, the kind of crisis that we faced, certainly those don't exist, but yet a lot more needs to be done.
Yes, certainly. I mean, I think every country in the world was taken unawares, and India was able to measure up beyond the expectations of the whole world and managed very well despite many things which could have been done better. But this is not the time to go into that. I would say that India was able to do two things remarkably well, which very few countries were able to. One was that at the subnational level, the state level, every state, some slowly, some very fast, were able to pan out using the district system, which only India is the only country in the world which has that system, district down to the subdivisions or talukas, down to the village level, using their entire machinery. And I must say the district magistrates and the chief medical and health officers together were able to literally enter the houses of people and oversee isolation, quarantining, and that kind of thing very, very early as March 2020, because I had done some work with 4 or 5 districts. Bilaspur stood out, so did Kasargod, and that was something remarkable. No country in the world, and certainly not on the scale that India does it, was able to do it. That was remarkable was that the messaging from the center to the states, particularly in 2020, was very rapid. It was 24/7, and I must say that the health secretaries of the states whom I interacted with, I did it purely out of interest. I had no other, I was not writing or doing anything on television about it, but I was interested, and I did find they were all very, very giving praise for the support that they received in terms of technical advice, hand-holding. And I think that the back-end work, which was, the creation of all the PPEs, the masks, we had nothing, remember, and we really became net exporters at the end of it. So I think on these 3 counts, India did exceedingly well, and we have no reason to feel that we are second to anybody. For the scale of the country, we've done very well. But having said that, I would also say that I think the middle class, that is the unorganized middle class, was caught napping because our country does not have anything like health insurance. And they were completely taken aback when they saw the bills they had to pay. And that is when the realization came that insurance is necessary for the unorganized middle class. And I would say that that's one area of great concern. The second is that we do not have anything called public health cadre. That is something that in the 2017 health policy had been emphasized. It was for the states, and I do hope that the budget would make a mention that they would have a central scheme or maybe some incentivization or set up some sort of a service which is a public health cadre, which is completely different from clinical and medical health care, which is all the the time, even in COVID, has been dominating all the discourse, which I think was something that should have been avoided. The National Centers for Disease Control is the agency under the Ministry of Health. We didn't hear about them at all. They were trained by CDC during the 2010 H1N1. I think this is time to rebuild that institution, because public health is very different from hospital care. Public health is what will prevent the onset of epidemics and outbreaks. So I would say that that is an area which does require great policy level support and financial support.
Thank you. Back to Ms. Chandra. Ms. Chandra, on the soft side, we have discussed that India has done very well and we have done remarkably in terms of managing this crisis. My question now is the back-end health infrastructure, let us say medical colleges, hospitals, the setting up of these things. Why is it so difficult to set up a medical college? Why are there so many requirements, so many permissions? Shouldn't this be the time when we look at healthcare sector in general and health infrastructure in particular as a strategic sector and push for it as much as we can, given that there is this opportunity, apart from the fact that our share healthcare spending is not up to mark?
Well, when you talk of health and infrastructure, I think one should be very clear that the beds in the hospital beds throughout the country, more than 2/3 are in the private sector. And when you talk of hospitals, the chains, all your Apollos and Max and Fortis and Narayan Hridayalaya and all, they account for just 5% of those beds. So there is a huge private sector which exists, which is almost 65% of all the beds that you own. What is in the public sector is basically, if you really put the beds together, it boils down to the hospitals run by the government, which are, of course, huge when you think of the size of some of these hospitals. All India Institute, Safdarjung Hospital, the state hospitals, they're huge. But comparatively, the bed strength is much, much lower. Now, that bed strength has to be improved upon. And when you talk of medical colleges, I think the policy decision to try and convert all the district hospitals into medical colleges is one of the most, I would say, futuristic and something which should have been done maybe 20 years ago. Because a medical college, when you ask me why does it take so long, it's a question of, do you have all the infrastructure, which is not bricks and mortar? It starts even with having dead bodies for doing the anatomy work. Do you have everything that goes into making it worthwhile for a patient to enter the hospital? When medical college permissions are not given, it is usually because there are no patients. A college needs patients to teach the students. So if you don't have the kind of teaching faculty which is able to give the kind of teaching that the students need, patients will not go there. They also know what is good for them. So when you are able to convert a district hospital, it is a win-win situation because the patients are already there. But you do need better quality of supervision, better monitoring, and I'm sure that will come. So in one sense, the medical college at the district, the district hospitals being converted will be, if it's taken up by the state governments in all earnestness and they're given support, financial as well as technical, I'm sure that is the way that would improve things phenomenally. But having said that, let's come back to the 65%, which is the private sector. There, I think that we have not really paid enough attention. Every time there is some discussion, you're looking at the chains, you're looking at the hospital chains. Now, when foreign direct investment came, and it came many years ago, 20, 25 years ago, it was approved as a policy and has been consistently supported by every government, allow foreign direct investment into the health sector. Once that comes, one must understand that people are in it for business. It's not a bad word. Now, if they're in it for business, they are going to look for profits, and they're going to look for maximizing of the profits. There's nothing wrong with that. That is why government has a very big role in regulating that private health sector, which is basically the sector which is charging a lot of money, giving a lot of service, no doubt. But the telecom sector has a regulator. The power sector has a regulator. How come the health, which is totally, I mean, it impacts so much on the patients, on the consumer, it doesn't have a regulator. It is necessary because the consumer courts hardly look at medical negligence, medical malpractice as an issue. They're looking at so many things, starting from toasters and all kinds of other small household gadgets, right up to something as important as somebody having been operated wrongly or a paramedic having completely finished a case, because hospitals they spend a lot of money on protecting themselves before the court. But that can take years. So just to round up what I'm trying to say, I would be very happy if the budget announces the setting up of a medical tribunal or a medical, you might say, regulator. And it is not to interfere and find fault. It really has to work in a very professional way. And it is working exceedingly well in the power sector. It's working extremely well in the telecom sector. What is the problem in having the same sort of arrangement? SEBI and the Corporate Affairs Ministry is not the place to do it. So I would say that is something I would welcome. And people would, the consumers would welcome it hugely. So coming back now, if only 5% of the beds are in the health sector, that is the, you might say, the hospital sector, the chains. The rest, which is such a large number of beds, are all in the unorganized, non-chain kind of single hospitals and nursing homes. I think some kind of supervision is necessary over there. And for that, there used to be a Clinical Establishments Act. Many states have been dilly-dallying. If the center were to push for that and incentivize their taking it up, that act is already there in Parliament, passed by Parliament, but it's a model act. Every state has to really, absorb it according to their own conditions. It's more than possible, but the Indian Medical Association has always resisted it. I really feel the budget is the time to say that this will be done, because consumers going to all these standalone hospitals and nursing homes do need to be protected, and we don't have to overreach and make it difficult for people or to drive prices up, but there is a way of doing it which is necessary. So that is really my take on this.
Thank you, Ms. Chandra. Those are very deep insights, and if nothing, at least the budget should start the discussion and debate around this. If it's a concurrent subject where the union as well as the state governments have to work hand in hand. Mr. Mult, thank you very much for being here. It's been a pleasure.
Okay, thank you.
Thank you very much.